Goals of this talk are to cover some LGBTQ terminology, to give you some context of the lives of LGBTQ elders, and to give you some suggestions on improving your workplace, as well as give you some resources. So first off, so we're all on the same page, starting with terminology. Trans is an umbrella term that encompasses a diverse group of people where their gender identity or their gender expression is different than social expectations. So trans can include transsexual, transition, transgender, genderqueer people, as well as some two-spirit people. Not all folks who identify as two-spirit identify as being under the trans umbrella. Heteronormative is a word for explaining the way that heterosexuality is the assumed norm, and either trying to look like that or be similar to the heterosexual norm. Gender nonconforming, that can fit underneath the trans umbrella as well, being somebody whose gender is not conforming to societal expectations. Cisgender and cissexual are terms for people whose gender identity matches their biological sex. So somebody who's assigned male at birth and grows up and identifies as a male would be a cisgender male. There are some people who prefer to use trans and non-trans because it centralizes trans people. And I have a little asterisk on this because the language is changing very quickly. So the words that I'm using in this presentation today might not be applicable, a year down the road, maybe less than that, because people are creative and we have a living language. This image is helpful for understanding some differences between gender identity and sex. Often people tend to use one for the other when actually they're different ideas. Gender identity is how the person thinks about themselves. So if they think of themselves as a man or think of themselves as a woman, or if they're kind of somewhere in between, the current term is genderqueer or gender nonconforming, gender creative. There's quite a few that kind of fall in that middle zone. Gender expression, so that's how if somebody chooses to wear makeup, if somebody likes to have a buzz cut, or maybe kind of likes to go for more of an androgynous look, this is how the gender is expressed. Also, it can be looked at through actions and behaviors and the way that you interact with other people. Biological sex, that's usually what ends up on your birth certificate. There is actually quite a variety of folks who are born intersex as our technology has gotten more advanced. But most people fall are somewhere on the male or female end of the spectrum as far as biological sex. And then sexual orientation is who you're attracted to. So if somebody's attracted to a male and attracted to women, they would be heterosexual. If they're a man attracted to women, they'd be homosexual. If they're attracted to both, they might use the word bisexual. The word queer is used more on the coasts, I find, and making a bit of a stereotype, but more often with younger people. And how does this relate to aging? So in a recent survey of humans, researchers have discovered that 100% of people are aging. So it's happening to all of us. But then wondering, like, how many people fall in the LGBTQ spectrum. So despite there being research on it, there's still a lack of clarity on what the exact numbers are. Some of this has to do with stigma, people not wanting to out themselves even on an anonymous survey. people might be ashamed or embarrassed and so not answer the questions truthfully, or there are places in the world where being homosexual or trans is illegal, so it could actually put them at risk by outing themselves. The estimates currently are around 3 to 10% of the world falls into the lesbian, gay, or bisexual end of the spectrum. Up here in Canada, Stats Canada, the main census does not ask sexual orientation, but since same-sex marriage was legalized in 2005, the 2006 and 2011 censuses have some data. Unfortunately, they've only taken the numbers for major cities. There was some question as to seasonal workers in Alberta living together as people of the same sex and assuming that they were a same-sex couple when they were just there because of seasonal work. So they've only taken those numbers from the major cities, so they're not very precise. In 2014, the Stats Canada added the Canadian Community Health Survey, and this was the first Stats Canada survey to ask about sexual orientation. Unfortunately, according to Stats Canada, once you hit age 60, you no longer have a sexual orientation. So sorry if anybody plans on, or if anybody's reaching close to that age, that you suddenly, according to Stats Canada, just don't have an orientation. You're no longer attracted to people. But for the people who did reply, 1.7% identified as either gay or lesbian, and then 1.3% of people said that they were bisexual. So about 3%, which fits within that range that we saw before. Oh, trans Canadians. So there's currently no measurement of how many trans people are in Canada. The current estimates are between 0.3 to 0.5% of the world population. And based on that, so the current population of Canada is 35.16 million. So based on that number, we can estimate that there are about 480 people up to 175,800 trans people living in Canada. What's interesting is to think of as people are aging. Stats Canada is estimating that there will be 9 million people over the age of 65 in Canada by 2031. So doing the math again, that's quite a lot of trans people that will be living and needing resources in Canada for senior services. Also, just a point of reference, somebody you may all have heard of is Caitlyn Jenner, and she's currently 60. So thinking of all the youth out there. So think about the last time you filled out a health-related form. There's a chance you probably saw a question like this up on the screen. Check 1, are you checkbox F or are you checkbox M? Now, the problem with this is that this question cannot capture information about trans people. So if we don't track it, we can't count it. We can't say how many people are out there or do anything about it. So the current best practice is to ask a two-part question. The first one is asking about a person's gender identity, and then a second being a question about what sex a person was assigned on their birth certificate. And currently they're finding they get about double the number of trans people by using this two-part question, because not everybody who has gone through a medical transition considers themselves transgender. So they might look at it as just the period that they were going through medical procedures. So now I'm going to try and show you a quick little video here. So we're going to see how this goes. Share application.
A lot of people believe that you just live happily ever after, and that just is a myth.
People like ourselves, older, are hiding in nursing homes or whatever because they are scared to death.
It's incredibly common to go back into the closet again.
You just know when they don't want you there.
We've heard about homemakers going in, taking out a Bible and having the elder pray and asking for forgiveness.
And to be cured. It's not too late for you to be cured of this. They go back in the closet. She might mistreat me or abuse me.
They're so afraid of it, they are resisting any kind of medical attention.
That person was in their mid-20s during the McCarthy era.
The closet was the norm.
Families
Were involuntarily hospitalized in psychiatric facilities.
even electroshock.
The degradation of these people is so complete that their sex satisfaction comes only in being tortured themselves.
I was on the route to the nut farm.
So there's a real distrust of mainstream institutions.
I would never put myself in danger.
He became much more fearful of people knowing that he was gay. You're not leaving now? Right.
LGBT elders are more likely than the general population to age alone because many gay elders never had children, have not had great relationships with their families of origin. There would be a higher degree of sort of alienation and isolation.
My family was the reason I existed, and I lost them all. If they ever choose to catch up before I die, I welcome them.
LGBT aging issues are an epidemic.
There's a small and growing group of us.
We're trying to go into the existing network so they become more inclusive. One of the common lines we get is like, we don't have any gay elders here.
If I wasn't the only person sponsored for Alexander, I would have ended my life.
This is our life.
Good to see ya! Hi! Be there in a few years.
I built a stairway paradise.
Oh, with a new step every day.
We have a whole generation of people who don't know who we are. That's really sad, because you're missing out on a lot. We know a lot. We did a lot for you. You wouldn't be here if it weren't for us.
If I'm scrolling, too bad I don't have an open casket. Well, there'll be no open casket. There won't be anything, right?
If we are saying come out and be filled with pride, it's our responsibility to make sure that continues right through their last day.
All right, let's see if I can get back to the other one now. Oh, good, that worked. So the video gives you a little bit of an idea of like why it's important that we be aware of and attentive to the needs of LGBTQ elders. To put this in a little bit more context as well, like they were saying that people were in their 20s during the McCarthy era, but also the diagnosis of homosexuality as a mental disorder was not removed until 1973, and it actually wasn't fully removed until 1976. This picture down here in the corner was a psychiatrist, and he was gay, and he was afraid for his job as a psychiatrist to testify in front of the American Psychiatric Association. So he went in as Dr. H Anonymous with wearing a mask and wig in order to testify because he didn't want to lose his livelihood and going in and testifying in front of, as they were changing the DSM. Previous treatments for people who were diagnosed as homosexual, they talk about people being forced into therapy for a long time, doing aversion therapy, actually being locked up in institutions, and electroshock therapy. And prior to me doing this research, I was talking with a friend who's a nurse, and she's 62. And I'd heard about electroshock therapy. However, I'd always thought that was something in the dark ages, because clearly that just seems like a horrific thing to put somebody through without their consent. And she told me that when she came out, she was around 13 or 14, and there was a little school group that she was a part of. And one of the girls in the group, her parents took her out and put her through electroshock therapy, trying to cure her. And she said that her friend was never the same again. And it really struck home to me that this friend of mine, that people that I know are of the age that they could have survived this. So to put it in context here, somebody who is 65 years old today in 2016 would be 22 years old when the DSM was changed. And that was just in the diagnostic manual, but there would still be a while before society's opinions changed. So somebody who is a teacher, if they were fresh out of college and getting a new job as a teacher would be, or a nurse or somebody working with children would be very afraid of losing their livelihood. That was 43 years ago today that was taken out. So it seems like a long time ago, but when we're looking at elders, this would be quite recent. So the experiences of these elders are that the institutions that they are getting placed in, like as a retirement home or being in the hospital, could be very frightening to them, as there is risk of, back when they were younger, of getting harmed by these institutions. Some issues that are relevant to LGBTQ elders are discrimination and stigma, like we've been talking about. Social isolation. Many people who came out lost contact with their family of origin, the people they were born to, and may or may not have formed relationships as they got older. So isolation can be quite a big issue for folks, that they might not have a big circle of friends as they've aged and not gotten out and about as much. Housing can also be an issue that's related to, and that's connected to finances. And then some specific things for trans elders, because there's the Trans Pulse survey, which was done over in Toronto. They were looking at the income of trans people compared to the LICO, which is the lowest. They don't have a poverty level, but the lowest income where you're not paying more than half of your rent as income, and most trans people fell well below what the income was. The column over on the left was for people living in rural areas where cost of living is a bit cheaper, and it actually came out to be the same for trans people, that they were making around $15,000 a year, whereas the low income was set at 28, just under 29,000. And then in the big city, where often rents are higher, and that gap is even larger. So thinking about trans people who income consistency might not be there, as well as the amount of income that they're making. So once they've reached end of life, they don't have an RSP or a 401k type thing to have a financial buffer. So there's not the economic resources available to them. This chart is based off the Injustice at Every Turn. It was a trans survey in the United States, which, since we're still waiting for the second round of numbers to come out, so far is the largest study of transgender people it was both online and written survey. And this is, again, looking at what the general population is in light blue, and then the dark blue people who fell somewhere underneath the trans spectrum. So you can see that 15% of respondents were making less than $10,000 a year, which was even less than what they found in the Trans Pulse survey. And a majority of people making less than the rest of the general population. So again, another sign of how income makes quite a challenge for folks once they've reached an old age and are on a fixed income that probably is not going to be supplemented. This is from the Injustice at Every Turn trans survey. Likely to be unemployed. We're four times as likely to be unemployed. So thinking about intersectionality, if somebody's facing any other issues, so if they're a person of color, if they're somebody with a disability, somebody who is an immigrant, there's definitely many more barriers to that person accessing resources. This is again from the U.S. survey, that just to show what kind of things that people had faced. So of the people who responded, so these are people who are still alive, since you can't posthumously fill out surveys generally. 41% had attempted suicide, which in comparison to the general population is 1.6. So definitely a huge number of people have considered this based on the discrimination and stigma they faced. And that number got even higher if they had lost a job on account of bias, if they had been harassed or bullied in school. And there's research that says that that has a lasting effect on people. Like even if they've survived past high school, they're still impacted by their experiences of bullying in high school. Also, the suicide attempts increased with physical and sexual violence. And there were examples of people who were assaulted when they were attempting to access services, like in the emergency room or in a hospital. So definitely a lot of distrust of healthcare systems for trans and LGBTQ folks. Some other things that are unique to trans people is that sometimes it is not possible to get legal identification that matches their gender identity. Not every state allows in the U.S. allows people to update their birth certificate. Some places are getting better about, I know in British Columbia, you don't need a letter from a psychiatrist to go and get your driver's license changed. So it's getting better. However, as people are aging, mobility becomes an issue, and getting down and dealing with the bureaucracy of updating these documents can be very challenging and becomes more so. Medical treatment. Not everybody has the resources to get medical treatment so that their body matches their gender identity. So you might have an older person who identifies as male but may have a uterus and vagina and need pap tests to make sure that there's no cancer or lesions forming. Also for trans women, a trans woman might still have a penis and so need a different kind of catheter if they still have a prostate. So things like this that don't line up with people's expectations and can expose them to mistreatment or ridicule. That can be very frightening when you're in a vulnerable position of having to rely on a healthcare system in one way or another. The Canadian context, going a bit further with this, there's the Canadian Human Rights Act. Currently, the Charter for Rights and Freedoms does not include gender identity or gender expression. There are many people lobbying to try to get this changed and updated. Most provinces have some form of protection, but it's not consistent, and it's not at the federal level, which poses some challenges. And there's an issue with trans folks, and I'd say even with lesbian, gay, and bisexual people, of not seeing examples of what elders look like, of what it looks like to grow old. And these are some quotes. I was talking with Devin McFarlane, who's the current president of the Canadian Professional Association of Transgender Health, that he's somebody who has been around the world and knows thousands and thousands of trans people, and he said he doesn't have an idea of what it looks like to grow old, and that he only knows 2 trans people in their 70s, which is pretty astounding, of not having an idea of what aging looks like for somebody like yourself. There are some attempts at resilience that, despite all of these things of high suicide rates and whatnot, that there are people who are finding ways to celebrate gender diversity, celebrate sexual diversity. In Vancouver, some attempts, this is from the Canadian Book of Trans Activism. There were some events held in the community to show that there are actually people who are proud and happy to be trans, and that by not only existing but celebrating it are examples of resistance and resilience. A little note that the folks who used Tranny Day at the time were not in communication with a lot of trans women, and it's actually a term that tends to be used in a derogatory fashion. So they had changed the name to Gender Euphoria Day the following year, and had a better turnout that following year with the change in term. There is the World Professional Association of Transgender Health, which they work internationally to attempt to depathologize gender. They're creating more normalcy to gender variance and working to make medical treatments and identification documents more accessible around the world for people. There's this cycle of invisibility that happens with, most often with lesbian, gay, and bisexual people. You can't always tell on first look at somebody unless they're holding hands with somebody of the same gender what their sexuality is. So there's this invisibility factor, and like they said in the trailer for the movie, that people are going back in the closet and that they're afraid to be out, afraid to be visible as a gay person, as a lesbian. But not all trans people have this option. So they might want to hide, but that might not be an option for them. So there's a variety of possibilities out there. So now we've kind of got some of the context, some things that you can do. So number one, and this also matches up with research I did with LGBTQ patients, asking them about provider behaviors that enhanced or impeded quality of care. One of the biggest requests when I asked, well, what do you wish providers would know, was that providers educate themselves. Often there are situations where providers are asking their patients for what they should do medically, and that's not appropriate. Another thing you can do is look at your documentation, your policies, and even just images. If you have a pamphlet about what your organization is about, are they all pictures of white heterosexual couples? Are there pictures with mixed families? Are there pictures with same-sex families? Just looking to see that the diversity of people is reflected in what images you're putting up. And with documentation, creating space, like with the two-part question as to what somebody's birth sex is and what their gender identity is, so that there's room for them to be represented. So if somebody goes in and they don't see space for themselves, even reflected in the documentation, it's a little sign that maybe it's not safe to be there. And remembering that not all families are connected by blood, so people may have created their own families, sometimes calling them families of choice, that they find people to bring close to them that they might not be able to say, well, I'm their sister, or but for the some more suggestions. Also making sure that your staff, volunteers, family members, that there's opportunities for training. I'll have some links a little bit further in these slides here that can give you some suggestions around that. Also just getting aware of the variety of relationships there can be and networks, as well as if there's local communities. Like in Victoria, there's the Lesbian Senior Care Society. That could be somebody to reach out to, or if you're in a smaller city looking to see if there's even a local Pride Parade contingent, something like that to reach out to folks. And again, looking at your organizational policies, looking at the languages and pictures that you use, and connecting with venues, events, getting out there and getting connected is definitely helpful. So they see you and you're out there connecting with real flesh and blood humans. So here's a page with options for more information. The Fenway Institute in Boston there's a research center as well as a clinic. So they have information on both. They've got some great informational slides available on the Fenway Institute website. For transgender-related issues, the Center for Excellence in Transgender Health has policies. Up in Canada, we have the Canadian Rainbow Health Coalition. They have a section on older LGBTQ folks, which is great. Also at Simon Fraser University, they've been doing some research around end-of-life conversations for LGBT folks. So they have a number of resources listed up on that website. And in the States, there's SAGE, which is Services and Advocacy for Gay, Lesbian, Bisexual, and Transgender Elders, which provides quite a number of resources. You can also go watch the full documentary, Gen Silent, which is great to hear some stories. And as you watch it, think about these are all people with resources who are able to be a part of that video. So the story could be quite different for somebody who doesn't have all the financial stability that those folks do.